I've used the public system before, most recently Children's Hospital, and I find that once you play by their rules, you really don't have a problem. I mean, you do have your usual issues, not enough furnitures, etc., etc. But I guess, from my perspective, the service from the doctors, nurses especially, can be very good. But once you understand their rules and play by their rules.
Well, it can be a little better than how it is because, number one, we're still seeing mentally ill people walking the streets. Right? Number two, if you visit certain health centers that are governmentally owned, you have to wait till a whole day to get through when things can be put in place. So we can, not because it's free, means you have to take in the whole day to get through. You understand me? But when it come on again to like the facility, certain health facility where you go, it can be in proper measures, because if you go certain restaurants, you get out when the health system need to get along more to say, all right, let's visit some of these places to see how they are, so we don't come under any attack from the public.
So for healthcare in Jamaica, I think in terms of planning, they need to do a lot of that. Why? Of course, if the children are the future, I'm sure in terms of birth, most persons is scared to have kids because their healthcare is not managed properly. Of course, they're trying to find the facilities, but if they make more resources and also plan to how to create more resources, then it can be managed. But for self-care and patient care, because I'm also in the patient care, so in order for more persons to want to be able to invest in it, they have to make it attraction. Like attractive in terms of like for health centers, they have to have the facilities. Because the health centers are there, but do they really have the facilities? So those are the things that they have to take a good look into. Provide the right resources and facilities for all, Jamaicans so that they can be able to utilize it.
Not satisfied, because my grandma fainted on me and I took her to public and she had to lay on a piece of cardboard, which was not good. I know the government can't cater for everybody, but healthcare is something very essential, and I think you should pay the same attention that you pay to the prisons. You should focus more on healthcare.
When I find myself going to the doctor's office, sometimes I think I wait. Case in point, wait 2 hours to be seen in 5 minutes. So that's one. A lot of things that could be improved. Work in progress, as they call it. But yeah. I can work with it, but there's definitely room for improvement.
Just as we're talking about, look at that man walking with a barefoot. This is what I'm trying to tell you about. The health system can be better in the country to take care of some of these people, to get them off the street, build a facility for them so they can stay. You understand me? Get their needs that keep them mentally fit. Yeah. You understand me? So they can, the country can develop and be better. So if tourists want to take a trip to New Kingston, or if they want to take a trip to Crossroad, they can say, wow, I can recommend anybody else from any other else country to visit this country because it's so put in place. If you go to Canada, you don't see this thing, Canada is a well clean and developed country. You don't find certain things. Number one, I can leave you with this by saying, if you go to Canada, not even food you can eat on the street. You have to put it in a brown paper bag and walk with it.
Most persons, they really don't have the money, and then they need treatment. But in terms of like medications, I do see they're making a little effort to provide medications like the JADE programs and the NHF and stuff like that. Yeah. But in terms of like healthcare facilities, like if somebody needs a surgery or any little thing, they need to find the right facilities and resources. Because it's there, but they have to allow all of the attractions to come on board. Because they themselves can't do it, right? It takes a lot of communities and committees.